Welcome everyone who's joining us this evening for this awesome discussion. As Michele shared, we are going to be talking with Mailae Halstead, who is a nationally certified counselor currently based out of Tolan, Connecticut. She has been doing a lot of work with clients suffering from PTSD and OCD and using alternative medicines that have been empirically supported in their treatments. She's passionate about practicing psychedelic-assisted psychotherapy, and it centers around cultural humility and empowerment. Mailae is part of the Connecticut Expanded Access site sponsored by the Multidisciplinary Association of Psychedelics Public Benefit Corporation. That is a little bit of a mouthful, but MASPBC for short, using MDMA-assisted I lost my place. Sorry about that. Using MDMA-assisted psychotherapy for the treatment of PTSD. She's also a teaching assistant for the Integrative Psychiatry Institute's Psychedelic-Assisted Psychotherapy Training Program. And Mailae regularly provides ketamine-assisted psychotherapy for treatment of depression, PTSD, and anxiety. She aspires to contribute to a future with equitable and destigmatized access to psychedelic healing. Thank you so much, Mailae, for joining us. We are absolutely excited to talk with you today.
Yes, thank you so much for having me. I'm really excited to have this conversation.
Well, it's definitely a conversation that's overdue. Starting, I want to first let everybody know, as Michele stated, there has been a little bit of a strain with the internet. So if we do go dark, or if I go dark, or if Mailae goes dark, we will definitely continue through, or we'll have Michele pop in if for some reason I disappear. So definitely bear with us if we do have some technical challenges, but we are going to get through this as best we can. And in regards to your work, Mailae, I was hoping first if you can do a little bit of a history with us. In terms of the alternative use of these substances in treatment, about how long has this been going on? And because we know that it's been a little controversial, but it has a rich history.
Yes, yeah. So psychedelics have been around for actually centuries. They have bearings in different ancient cultures, particularly native cultures, with the use of psilocybin and ibogaine, as well as mescaline, also known as peyote in some cultures too. And then at some point, there was a sharing of psilocybin in particular with kind of westernized cultures, and particularly, I want to say Americans at the time, with Maria Sabina out in Mexico. She was a healer that was using psilocybin at the time and had extended some of that with us. And then we had this big boom that also happened kind of in the 60s and 70s and maybe even a little bit beforehand. I get the dates a little bit confused because there's a lot of dates involved here. But MDMA was one of those that were kind of pioneering now, and we're seeing really open up. There was also LSD as well that has been used as a psychedelic that was kind of, these are synthesized in labs. MDMA in particular was originally used for couples therapy. It eventually made its way into rave scenes, as well as the psilocybin, as well as other psychedelics. And so they were deeply decriminalized throughout the war on drugs. And so a lot of the therapeutic use and the compassionate use of these medicines became very stigmatized for an extensive amount of time. And over the past 2 decades or so, we're seeing this emergence of the compassionate use in a more therapeutic and medicalized setting, though that's not the origins of all of these.
Well, I'm so glad that you're able to share that, because it in some ways is kind of like going back to this natural experience of, using medicines that have been around for such a long time. I'm hoping that you could talk a little bit about your work and how you have been working with these stuff in your therapies. So can you share with us like your first foray into treating a client using the psychedelic assisted therapy?
Yes, yeah. So the first client that I treated, so first I was originally trained for the first time in ketamine assisted psychotherapy in January of 2019. So still haven't been working with this medicine for so long, but I've been focusing a lot of my work on it. I've sat for these sessions for like over 100 hours worth of sessions at this point of just the medicine sessions. But my first encounter with that was being trained in ketamine assisted psychotherapy. I happened to work alongside a woman, Dr. Monica Williams, who she's our clinical director of the private practice I work at. She had spearheaded one of the MDMA assisted psychotherapy sites through MAPS that was at UConn at the time. And so she had a background in research and was also wanting to see how we can merge ketamine, which it was legally available instead of a research setting. I mentioned that because that kind of helps give a little bit of foundational knowledge of how I got into this work and to have my first ketamine client. And so our director of psychedelic services is Sarah Reed. She's a woman that had been working alongside Dr. Williams and had this really treatment-resistant kind of case with PTSD. In particular, this woman was at the time suffering from racial trauma in the workplace. And Sarah was like, well, you're trained in ketamine. This person really needs MDMA-assisted psychotherapy. Why don't you join me on this case? I think you would be a really good fit. And so that was actually my first case, was treating somebody for racialized trauma in the workplace. This person had had a significant PTSD history due to other things. She had significant treatment, had success with it. But then after this incident in her workplace, she was re-traumatized and unfortunately was put on disability as a result. And that was my first ever case, which was like a really significant case. Oftentimes ketamine is actually used straightforward for depression, but this person did also struggle with dysthymia, which is a persistent depressive disorder. I'm a therapist, so you guys know what I'm talking about. But that was also what she was struggling with, in addition to the PTSD, and had some significant alleviation of the symptoms. I actually did a talk on this case presentation that was actually just posted up on YouTube for anybody who wants to know more about this case. I did a conference back in August with Big Psych, and so if you look up my name on YouTube and stuff, you could actually see the details about this study.
Wow, awesome. It sounds like it was such a rich experience and really kind of supported your growth on this track. Can you tell like our viewership, what are some of the aspects of like the training that you have to undergo in order to become specialized in this area? Like, you know, I imagine you have to go through your clinical training, but what else would you have to do in order to be able to practice in this industry?
Yes, yeah. So I would say, honestly, my mentorship has helped me significantly to get where I am today. So as I mentioned, when I was kind of answering that first question, I worked, my supervisor this entire time was Dr. Monica Williams, and I also worked alongside Sarah Reed, who's also a licensed marriage and family therapist. And so they kind of not only took me under their wings in terms of mentorship, but also kind of put me in the direction of getting the appropriate trainings that I needed for this. And so Dr. Williams had put me in partnership with MAPS to be trained under for the treatment of PTSD using MDMA-assisted psychotherapy. And that's how I got in with them. And I'm also, as I mentioned during the introduction, is in part a teaching assistant for the Integrative Psychiatry Institute. And so that's been something that I was also kind of spearheaded through Sarah too, who had kind of put these opportunities in my lap. And to be honest, without them, I wouldn't be where I am today. And so I feel really fortunate for having such strong mentorship. But when it comes to the actual kind of training itself, I would say, honestly, it's all the lectures, everything like that, is a lot of it is available on YouTube. And I would highly suggest anybody who's interested in that, so much of the information is free and available. And just if you're interested, start there. And it doesn't have to be just the, hundreds of dollars that get dedicated to these training programs. In a lot of cases, it's not something that is that far inaccessible. But I do recommend finding somebody who has been in the field for some time and seeing if they can take you under their wing, or if they're in the space to do so, and provide you with that level of supervision and that level of mentorship on how do I handle these very delicate cases with this new way of using a medicalized model for these medicines.
I love that you pointed out like a lot of this information is available and accessible on YouTube, which, our first thought in terms of getting like the expert training is to go to some school who offers either a certificate or a degree, and it's expensive, and it's not like many clinicians aren't already saddled with debt. So it's not something that we want to take more of on. I imagine aside from just that educational training, there are some things, that you're learning from other people, and some things that in terms of your willingness and ability to provide this sort of treatment. So I'm wondering, what are some things that you think your other clinicians really need to learn, and or like what are the mindset shifts that need to take place in order for them to be able to navigate doing this type of work?
Right, right. One thing that actually comes to mind is being comfortable working with pretty severe and treatment-resistant cases, to be honest with you. People oftentimes don't come in looking for psychedelics as their first go-to. That does happen, but that's not usually the people that we tend to see. A lot of the times it's people who have tried and quote unquote failed multiple medication combinations alongside their therapy, really significant programs. So oftentimes being mentally prepared for the intensity that comes along with, they have tried a lot of different therapy modalities before ending up in our offices. I think too, kind of recognizing the different, being prepared to know the different biological like rule outs in some cases too, and the neurological implications is really important, just to have a really informed conversation with your client. Like, I don't want to waste my clients' time and money if I find out that they have uncontrolled hypertension and cannot move forward with ketamine work. Like, just having that knowledge base there too. And then when it comes to the terms of like your own kind of mental kind of mindset going into this, recognizing your growth edges here when it comes to working with these medicines. There is a lot of stigma that is saturated in our culture, even I would say with the concept of like substance use disorder. And what is it like to use these medicines that maybe in some circumstances you might say that this person, if they're not using them in this medicalized setting, what implications or the training you've had might that indicate about these people who are looking to use them in a medicalized way. I think I was also lucky enough to have an advisor during grad school that oftentimes had challenged a lot of the kind of colonial paradigms that come along with the mental health care system and the structures there. And so that is another thing that often comes to mind when we're providing both equitable and ethical usage of these medicines. I think that that's something that's a big growth edge for a lot of people, because psychedelic therapy does kind of beg us to recognize our limitations whenever we're therapists in the different areas that might make us uncomfortable. So for instance, I think of the therapeutic use of touch, which is something that is frequently used in psychedelic therapy. Now, when I was in being trained in grad school, we don't touch our clients. That is an absolute no-go. Now I'm having to have a very different conversation here. And that was a huge growth edge for me. How do I have a conversation with someone to say, hey, it's okay to like put, your hand on my shoulder if you need that support, or hold your hand under these circumstances, not to mention when they are technically under the influence of a medication. What does that functionally look like? How do we do that ethically? I think being prepared to ask those questions of yourself and recognize where your own discomfort might come from. Also, the increase of transference and countertransference. When someone's under this medicine, that is bringing up a lot of feelings for them, a lot of varied emotions that might take years to kind of address in therapy. Sometimes that all comes to a point while under the influence of these medicines and during these medicine journeys. So those are some of the things that kind of come to mind with this that are really important to consider.
I love that you brought that up, especially the countertransference and response. Like, a lot of work has to be done just on that alone. So we're adding this additional substance that, you have to be okay with making sure is implemented. And I think that's just being able to check your biases, which we should be doing anyway, but making sure that we're checking biases at the door so that we can focus on providing, efficacious care. And I just love talking about the ethics of different situations, because I think that we're so ethical. And there are very, very easy situations to end up in ethical pitfalls. So really reminding our viewership the importance of having these discussions, having appropriate boundaries, making sure that you're in good communication with your clients, with supervisors, et cetera, to make sure that we're doing what's in the best interest of the client. And I'm hoping you could talk a little bit about what psychedelic assisted therapy looks like in a session for our viewership that may not be familiar with that experience.
Yes, yeah. So we oftentimes within the psychedelic therapy world refer to the concept of set and setting as a really big pivotal way in which we set the stage for the work that we're doing using the medicalized kind of model here. And so oftentimes what that looks like is a lot more comfortable than your standard office setting, and definitely nothing like a hospital setting, to give you just a little bit of an idea.
Thanks.
So keeping the lighting really low. There's usually like lots of plants, maybe artwork around. In some cases, we have either a nice sofa. We also have like a pull-out mattress type of thing if somebody chooses to have like more of a bed to kind of sprawl out on if they so choose. Usually there's music playing in the background that has been very intentionally picked for the client. The way we do our ketamine sessions at the clinic I work at a little bit different than some of the ketamine clinics that are the primary way that ketamine clinics are structured, in the sense that we don't usually do too many IM or IV sessions or intramuscular or intravenous, where the ketamine has been administered straight to your bloodstream and you have a big amount of what's called bioavailability of the medicine. We tend to use lozenges. So they dissolve under the tongue. It is something that is prescribed to the client and they bring them to our sessions. It provides a different route and a different experience as a result. You kind of slowly descent to this space in your journey, and then you gently kind of come back out of it too. And so that's our setting. And the set in this case would be, what is the clinician's mindset? What is your client's mindset and their intention maybe, or their goal for the session? And what is their dosage of this medicine? All of this kind of contributes to what that experience is of a medication session. And that's a really big talking point for us a lot of the times. How do I make this space comfortable to the client? How are they able to request needs while they are under the medication? Do they want the song changed? Do they want more warmth in the room? Do they not want eye shades on? All of these are going to contribute to the conversation and what their ketamine session or psychedelic medicine session is going to look like.
Awesome. And I appreciate that. It gives us an idea of like what the space looks like, what it feels like, and the client's input and how it's used in your sessions and well, in their sessions rather. So helping them to get comfortable and in a space where they can go through this journey with their clinician. Just kind of thinking about, these sessions, their therapy sessions. We're talking about, psychedelic assisted therapies, and there's ketamine, MDMA, psilocybin. I still say psilocybin, ayahuasca, ibogaine, and other alternative, I hate to call them drugs, but alternative medicines. I'm wondering, what's the efficacy of this type of treatment? What have you seen in terms of positive outcomes, and have you seen any negative outcomes? But what's your experience then?
Yes, yeah. So I would say the main three that have the strongest efficacy, because it's backed by so much research right now, is going to be ketamine, MDMA, and psilocybin. There are ongoing studies for these other psychedelics as well, such as ibogaine, ayahuasca, and mescaline. But right now, the focus has really been on those three that I mentioned beforehand. So the most indicated with ketamine right now has been depression. That's also to mention, though, that there has been significant research that's being undergone as we speak right now with PTSD, and a little bit with OCD as well, and some anxiety disorders. But ketamine typically gets paired with depression and depressive disorders of any sort, and a little bit about, I think, bipolar depression too, which is quite exciting for folks who sometimes worry that psychosis in those who have any sort of psychotic symptoms, that psychedelics is off limits. And that's actually not necessarily the case. We're doing more research to figure that out. Then when it comes to MDMA, that's most indicated for PTSD. I think that there's originally MDMA was actually created, by the way, for couples therapy. I think that's a little less known for the general public and sometimes even within therapists. And because it has these beautiful heart opening effects, is as it's oftentimes referred to as, is that so PTSD is a disorder of disconnection, and MDMA is a substance of connection, which makes it a beautiful tool when undergoing psychedelic assisted therapy. And when you put that against the available therapy treatments as well as the available medications, MDMA just absolutely surpasses all of that. Both MDMA and ketamine in particular, through the FDA, were granted what's considered breakthrough therapies. I believe psilocybin actually was granted this too. And breakthrough therapy designation essentially means that when it's put against the available therapy modalities and the available medications, it is so above and beyond that ethically it would not be appropriate to continue to withhold these therapy modalities any longer, these substances in conjunction with therapy any longer. So it's really impressive when the FDA is like, well, let's push this along, because the FDA tends to be really slow, to be honest with you. So that's
yes. Well, that is such awesome data. Like, I think the fact that, a lot of people tend to be apprehensive or worried about these substances being used in anything, because of course, in our country, we tend to see substances being abused rather than used, equitably and efficaciously. So being able to hear that they have such a positive impact in terms of treatment that, FDA is even saying, we really need to make sure we're putting this out there so people have access to. That's a big statement. And just comparatively thinking of couples therapy and some of the challenges that couples face, how long sometimes talk therapy can take before we start to see, the changes. They say brain, neurons that fire together, wire together. So it takes a lot of repeated acts in order to get to a place of feeling safe to even be able to explore. So, at the same time, I'm a little cautious because, like everyone else, we want to take our time and do things well. But if this does allow, clients to see health benefits in a way that is quicker and really gives them the opportunity to grow at the same time, why aren't there more? We need more folks with the same amount of knowledge. Yeah. So thinking about that, what are your thoughts about, bringing this forward, making this, this treatment more accessible? How do you think it will change the industry? And just how do you think other mental health providers will fare moving forward with this new medicalized treatment?
Yes, excellent question. Yeah, I think that there is so much positive outcome that, in so many ways when it comes to what is available for mental health treatment has either been very lengthy treatments that are available, or something that, I think about the efficacy of your basic SSRIs, for instance, where it's like it's a flip of a coin if that's going to actually produce the effects that we're hoping for in a client. And then you have something like ketamine. The clinic I work with also partners with from time to time Dr. Calabrese, who did this study. She is also a ketamine clinician, and she did a study out of her own clinic. Funny enough, she has no research affiliation, but just decided to do this on her own with her own work and background without any IRB. She had to figure out how to get in touch with the IRB on her own. It was very, very amazing, in fact. But nonetheless, she had this beautiful sample size of 290 of her patients who were experiencing chronic suicidal ideation, and she reduced their ER visits by 90%. And so That is incredible when we think about the way in which that's going to impact suicidal ideation alone, and then just what that does for depression and what that means for crisis situations too. Does that mean that we have to put everyone directly into a 72-hour hold at a psychiatric facility waiting for them to get the help they need? That really changes things in a very pivotal way in the first line of treatment, even for some of these situations. So I think that it has so many positive aspects, but I think it also should be held with deep respect and deep intentionality and responsibility too, because just as these medications and these medicines can be used in a very positive way, when they're used without knowing the knowledge behind it, without taking all the intention and care, it can be very harmful too. Sometimes we see this whenever I've unfortunately, we've had a couple of clients come to our clinic and have situations where they were not held very intentionally. And as a result, they have very negative experiences. And God forbid that be with a client that has like PTSD or some sort of trauma history. It can absolutely re-traumatize and exacerbate symptoms. And so I think one of the things is just being very intentional about the work you do and very well informed. You know, I know I mentioned at the beginning, like that there's a lot of resources available on YouTube. And yes, absolutely. But making sure you're doing this with like a mentor or some form of an individual who has already been working extensively with psychedelics beforehand too, because we want to have, there's no such thing really as too much supervision in this case, I would say, because each medicine is different, each way in which it's administered is different, and the setting and the set there is also going to have so many different implications. And really, I would love to see a future too, where it's like, a client comes in, they have whatever a diagnosis, and instead of being like, well, ketamine is what is legally available right now, I would love to say, no, your case would be great to start off with a dose of MDMA. And if after that it's indicated for, let's follow up with some ketamine sessions or psilocybin sessions, then we go in that direction too, instead of just, oh, ketamine's available. And I'm not knocking ketamine. I'm just saying that I really would love to see a very patient-centered focus on the way in which we're using these substances.
Right, and making it just as accessible as the SSRIs, the anti-anxiolytics, and everything else that's currently available. Well, I appreciate the perspective in terms of making sure we are practicing being supervised. Supervision and consultation is always important in our field. And then practicing in a way where we are putting it as patient-centered and focusing on their needs versus practicing based on in a very medicalized way, like let's, give you this medicine and I know I'm getting a kickback for it. So I'm going to start with that.
Right.
Unfortunately, we do see that a lot.
Yeah.
I'm curious, in what ways do you see ketamine and MDMA like complementing traditional approaches to mental health services?
Yeah. I would say like that is what is kind of we hope to do with like assisted therapy, because I want to make a distinction here too, is that like these medicines, and we see this unfortunately with the ketamine clinic situation, where people will want to have these medicines administered, and we love that. We want you to be able to have that available, but whenever it's actually paired with therapy, that's when you're getting the full efficacy of it. I think with ketamine in particular, as this is what I primarily work with, that there is a kind of a length of time after administration where you actually experience increased neuroplasticity, which is the ability for the brain to form new connections very, very efficiently and very quickly. And so as a therapist who works with that, immediately after, when we're in this window of heightened neuroplasticity, we follow that up with CBT therapy, all of the evidence-based work that's going to really help support this increased neuroplasticity that the client otherwise cannot achieve, or any of us can really achieve. We don't really have any medicines that do that for us, right? So when you're pairing those two together, it's like taking, instead of like a car from New York City to LA, you're taking an airplane in many cases, You're speeding up a process. You're allowing the brain to make these connections that sometimes it just simply cannot access because it's had a lot of training and thinking in these loops, and people get unstuck. Yeah. And so it's a huge compliment.
Yeah. Well, I can definitely see like how much this could open up the door for other disorders as well, where people are kind of stuck in a loop in particular. So I think it's fascinating to see all of these things really coming to the forefront. It's been in the news in many instances over the last few years, but definitely hearing about it more and more. I'm wondering what you've noticed in terms of the impact of COVID during this time, and has there been an impact on the industry, or has things been the same?
Yeah, it has been, we absolutely had some difficulties with COVID. And in many cases, there was just a level of adaptability that we had as clinicians had to develop that I don't think, I don't want to say I wasn't prepared for, but it was COVID. None of us really knew what we were expecting, right? So,
Right.
but I think of one client in particular, and she's doing fantastic now, thank goodness. But I really felt for her because she was of a vulnerable population. She was an elderly woman that was coming to us for after having spent most of her life with treatment-resistant depression. She
Wow.
had gotten to a point where she was experiencing some negative side effects after taking a SSRI for several years, and it worked, and then it just stopped, and she actually had negative side effects. And so she
Wow.
comes in, and it's in the middle of COVID, and she's like, "I'm ready to go. Let's do this." And I was like, "Great, fantastic." And well, at the same time, the vaccine rollout was kind of happening, and it was in this in between stage where it's like our funny enough, Connecticut had decided where it was like, okay, we're going to do most vulnerable populations first. And then they swapped it around and did it like, I think by age range in this very bizarre way. And so it pushed her scheduled first sessions back by like 6 weeks or something. We had did all this
Oh
work. And so like,
no.
I cannot imagine what she must have felt where it's like, I'm finally getting this little bit of hope only to have that goalpost pushed farther out. And so that was one of those scenarios where it was COVID absolutely impacted. And I was very thankful that this client did experience such positive side effects from ketamine. We actually were able to close out with therapy because she was like, I'm in a good pace now. I'll call you if I need this again, but right now we're good. But it did, like, I can't,
Right.
when you're working with an already very vulnerable population that's treatment resistant depression, more likely to have suicidal ideation, only to push off their treatment
Mhm.
further. And it's due to really, truly extenuating circumstances of their own like life or death. It really it put us in some sticky situations I had never considered before.
Right. Yeah, I can imagine, and being very worried and also wanting to rush things as quickly as you possibly can. Uh, yeah, I mean, we are still learning how to manage through this pandemic. Um, just in terms of access, I know like currently more people are being vaccinated, but
Mhm.
do you see that more people are coming in and accessing this type of support currently, even during the pandemic?
Yeah, I would say that honestly, our clinic did not slow down too much during the pandemic. We still had an influx of people wanting ketamine assisted therapy. We still see that now. In fact, since like March of this year, I have been waitlisted for like 3 months in advance. So we are not slowing down in any capacity. And we try to do our best and do it as safely as we can. I am lucky to live in a state that has like some of the highest vaccine rates in the country right now. So in many ways,
Hmm.
we
Hmm.
can do this work safely. It's mostly our younger populations that are unvaccinated. So when adults come in, we're able to somewhat kind of like breathe a sigh of relief, and not have to have
Right.
so many different stringent rules in place that before, we were really truly worried. And of course, Delta's still
Right.
going on, so we keep those
Right.
precautions going, but it's just we're not kind of like I guess that tense the way we were at the beginning.
Right. I was wondering about the impact of people being in the pandemic and, that isolation
Mhm.
that occurred as a result of like having to essentially hunker down and try and wait out the pandemic. Like a lot of
Mhm.
people were, I was reading, oh God, I think it was in the Atlantic. Yes, it's an article from the Atlantic that's talking about all of the self-help books that are being purchased, and I mean it's a very negative article about like nobody needs this, nobody
Mhm.
wants these things, but it's a booming industry, particularly focused on trauma. And like people who are buying these books are people who've experienced a certain amount of trauma. And the thing that the article didn't touch on is a lot of people who have been experienced or who have experienced trauma and never sought treatment used work in their daily life as a distraction from a lot of the symptoms that they were experiencing. And so being home being in the space on your own, you have to deal with yourself. So I was just wondering if like there was an influx of folks seeking a different type of treatment or seeking support, because this is like the first time they fully have allowed themselves to experience what's happening. Well, have been forced to deal with what's happening for themselves, right? Because of the traumas, because of being alone and just being put in a kind of a risky situation.
Absolutely. Yes. I think one of the things that oftentimes I let my clients know that when they're going into this ketamine work is that these are oftentimes lifestyle changes that we're having to implement within a shorter period of time than maybe we're normally accustomed to. It's quite rigorous work that, like, yes, you are being administered this medicine, but also like there's a lot of treatment that's going on around this, including like for instance, clients with depression, like a lot of behavioral activation, like we're adding to your schedule in a way that is best for you right now, that maybe is a different pace than they're used to, and not necessarily that we're adding more, but are we adding mindfulness practices to that? Are we adding more community-based care connection, and really actually having to shift what my ideas were for connection and community-based care, which is so neat for when we're in this very isolative society where everything is through social media now.
Right.
We don't have that face-to-face communication. So I really had to get very wise on the way in which what I considered connection at that point, and making these beautiful treatment plans and behavioral activation schedules for clients, when right now, okay, it might not be safe for you to connect and you're probably Zoom fatigued
Exactly.
too. What does that look like?
Yes, that's such a great point. And I think you've also touched a little bit on what, the aftercare looks like in terms of folks who have started this process, and, if they're weaning off of their treatment, then what is their aftercare plan? Are they connecting with community? Do they have resources? And it is frustrating that we're still in this pandemic almost 2 years later, but like how to support them so that there isn't a relapse of like the depression and, or OCD symptoms, because they are very situational in some instances as well. So how long does your treatment team follow the client post therapeutic treatment?
Yeah. So we're very much like meeting the client where we are. I think our clinic's a little bit unique, and we do try to pay attention to cost in terms of accessibility. And so to give you kind of like a general idea of what our kind of treatment plan looks like is that they do a consultation with us, and then after we feel like that's a good fit for them, and we determine that, then we're a little bit unique in a private practice is that we have a pretty extensive assessment process. And so usually that's about 2 90-minute sessions of assessment to make sure that we're continuing to fully understand, their symptom presentation at that point in time, history gathering, all of that. Then we do usually 3 to 5 preparatory sessions before they even have their first medication session. And one thing to add, they also have a full evaluation with our prescriber too, to make sure that they don't have any physical indications that might disqualify them for this available medicine. And so we do a medication session, and that's if it's for somebody with depression. And in general, we try to kind of space things out. We can do an IOP format or an intense outpatient format where we can do 3 to 4 medication sessions in about 2 weeks or so, 14 to 16 days, in some cases 21 days. But really, we do try to space this out, particularly for the trauma clients. And so we'll have a medication session 1 week, and then immediately followed with integration, a session or a week without medication sessions where we're just doing integration. And we kind of do 3 to 4 medication sessions. So it can last usually of the bulk of treatment, a month and a half, 2 months. And then we usually follow up 2 weeks post, 1 month post, and then 3 months post, usually doing integration all the while in between there. But it just really depends on like, what are those post-treatment measures? What do those look like? What is indicated for the client here? And so that's generally kind of what that looks like for us. Some people decide they want to stay with us for a little bit longer and love the integration, and I fully support that. And I'm willing to keep that going, because integration does tend to be this ongoing process. And sometimes a year later, a client goes, I had this insight that I didn't have before. And so sometimes it goes to that too.
Awesome. Well, I so appreciate you taking the time to share like all of this wonderful information. And I apologize if I asked a bunch of questions, but it's such rich information, and this is such a developing area of psychotherapeutic treatment that it really need to have more discussions about this.
Yeah.
I'm just last question, just wondering if you can share some thoughts for providers, mental health providers specifically out there, just to kind of prepare us for the growth that's ahead in alternative medicines.
Yeah. I would say definitely recognizing your growth edges here and being prepared to see where those land for you. What is it like to hear about these medicines when oftentimes our first indication might be substance use disorder or addiction and that sort of thing. Recognize what does that look like and where did you learn that from and how can this be informed differently? Also recognizing again kind of that there are so many free lectures and resources online. I think Shakruna is a really good website for learning different plant-based medicines in particular, and then psychedelics in the world. There's also like Psychedelics Today. I want to say that Double Blind has some really good information too. All of those are available online and do a lot of different both free webinars as well as like paid for stuff too, but most of it tends to be quite affordable. And also just finding a trustworthy therapist who's already been practicing in the field and having a conversation with them too, attending conferences on psychedelics, all of that is going to be really important and just, can't be too informed in this area. It is an emerging field, so stuff is changing all the time, and just be prepared for that whenever kind of diving in.
Well, I so appreciate the information that you've shared and the time that you've taken to talk with us. It has been an absolutely eye-opening conversation, and there's so much rich data to continuously explore and to seek out more of, so that if you're interested in applying it, that you do so under the correct supervision and under the correct practice. So I really do appreciate you taking the time. It's been wonderful chatting with you.
Yes, likewise. Thank you so much for having me. I really love and talking about this, and I am very passionate about it and hope we can have another conversation in the future.
Definitely. I definitely would love to have you back and ask more questions and see where the research is taking us, in terms of like where I'm not even going to say it, Ibogaine is going in terms of its efficacy in treatment, as well as ayahuasca. There isn't enough information. And like right now, ketamine is probably the most popular in the media right now. And so getting, out of just what we're seeing in the media and getting more into what we're seeing in the research, I think is really important. So I really love that you have given us so much rich information to work with.
Yes, thank you. Thank you so much.